All right, welcome to Chapter 10. We're going to be covering issues in theory, practice, and research. So to start off with, as you move into your career, whatever path you choose, you ultimately will have to decide upon what type of style you're going to implement with your clients. So, and again, I'll go back to using the AODA field as well as mental health field because that's what I'm most familiar with. I understand that there are probably many or some of you that are going into other fields, but when you start working with clients, it's important to find your own way, so to speak. So it's what I did was shadow people. I shadowed a lot of different counselors and observed their styles and how they interacted with clients, how they addressed inappropriate behaviors, how they praised appropriate behaviors. And so I kind of took the pieces that I liked and put that into my style and discarded the pieces that I didn't like. And then over the years, I kind of brought it into my own style. So whatever approach you do, it should be based, of course, in theory. And theory that's supported by research as well. So on page 373, there's some questions there towards the bottom that will help you make the evaluation of how you evaluate and what you emphasize in your counseling work. So an example would be, what does your approach emphasize and why does it appeal to you? To what extent does your theory address cultural factors? Does your theory have research to support its effectiveness? And how would you present your theoretical model in your informed consent document? All right, and then how does your theory explain how change happens? And that's very important because ultimately the goal when someone comes to see us is generally to make some kind of change. And so whatever theory you subscribe to, that theory should be rooted in research, and it should explain, among other things, how change happens. And you'll learn about this as you move forward into different classes in the human services field. And so it's just important to keep note of. All right, the other thing to consider too is when you're working with a client, I know this is going to sound out there, but not everyone is ready to change. And we cannot help everyone. Me as an individual, I cannot help everyone that comes through my door seeking my help. And there are multiple reasons. There's a lot of different variables and factors that play into that. What it boils down to is if that person, if your client, is ready to make a change. So where it becomes an issue when we're looking at ethical and boundaries side is that when we take on too much responsibility, we take on too much of the burden, we can really cause ourselves damage. We can cause the client damage too, because we start taking on the form of desperation. We want this person to succeed. We know that they can succeed. We're trying everything that we can with them, and they're just not responding. And you can actually cause more harm than good by doing something like that. So it's important to be able to take a step back and look at the situation and determine, am I doing everything that I can for this client? Yes. Okay. Is the client doing everything in his or her power to work through this and work through change? And that's a sobering question. If the answer is yes, then you're probably making some progress with the client. If the answer is no, then chances are you're doing much more work than the client is, and you're coming across as being desperate, and the client's just not going to respond to that. All right. The other thing to take into consideration as well is what types of goals are you going to be working with the client. So ultimately we want the client to make a determination of what goals he or she is willing to work on and most motivated to work on first. You may have someone come into your office that's being referred to you by a probation or parole agent because he or she has an addiction to cocaine, but that is the least motivating thing that this client wants to work on. Maybe the thing that the client wants to work on the most is repairing or restoring a relationship or getting his or her kids back. And so you have to meet the client where they're at, make goals based upon where they're at and what they're most motivated to work on, and then move in the direction towards the real issue, which is the addiction, the cocaine, and where that stems from. So it's important that it's crucial that goals become a part of any therapy session. I already mentioned that clinicians should not impose goals on clients, but some may persuade their clients to accept certain goals. That's on page 375 there. And so it's important to understand and determine who is really making the goals here. Is it me or is it the client? All right. Using techniques in counseling, there's a lot of different techniques that someone can use, and the more you have in your toolbox, the better. And I am really speaking about counseling right now, and I'm sure that these approaches could be applied across a wide variety of disciplines. But there's a list on page 380 and 381. You can read those. There's a lot of different types. The ones that I'm most familiar with is the cognitive behavioral. I've been trained in that and have been using that for many years. And also person-centered therapy as well. So there's a lot of different theories out there, and it's really based upon what your beliefs and your values are as a helper. And of course the research that supports it as well. So you can take a look at that and read about that. Assessment and diagnosis as professional issues on page 377. You know, it's important that we assess our clients. We're constantly assessing our clients. Every time they come in, we're listening to what they're telling us and listening for any changes, whether it be positive or negative, or maintaining. And based on initial assessments, we come to a diagnosis generally, or something that identifies a specific disorder or pattern of symptoms that leads to a specific diagnosis. And we do that using what's called the DSM-4 TR, which is text revision. The DSM is the Diagnostic and Statistical Manual of Mental Disorders. And right now, the DSM-5 is what's being promoted, and I think most insurance companies are going to require that professionals start using the DSM-5 by October of 2015. So we'll be implementing that, I'm sure, in the practice that I'm in currently, but right now we use the DSM-4, and that's simply because insurance companies haven't required us to use the DSM-5 yet. There are some rather significant changes in the DSM-5 that will affect how we determine how we serve clients. And so it's important to get training on that, if that's the guide that you're going to be using to make your diagnosis. All right. Okay, so talked about DSM-5. There's a little discussion about psychodiagnosis, a general term covering the process of identifying an emotional or behavioral problem, making a statement about the current status of a client. Okay, so some of the things that you can think about in regards to this psychodiagnosis: what brought the client into therapy, what are the client's strengths and vulnerabilities, what should be the focus of the sessions, what kind of support system does the client have. Those are some questions to ask yourself with using psychodiagnosis. And that's on page 385. All right. And then, of course, when you're making a diagnosis, you have to generally go by insurance standards, because we bill insurance when we make diagnosis, because person is receiving treatment, they're paying for treatment, or their medical insurance is paying for treatment. And so we have to collaborate with the insurance companies and at the same time deliver treatment based upon what we feel the client needs. Sometimes those clash. Sometimes insurance companies will tell us, oh, no, we're only going to pay for 6 sessions, and the client may need 10 sessions. And so we have to weigh the pros and cons of that and discuss that with the client and make the client understand that, hey, your insurance company is only going to pick up this many sessions. I feel you need X amount of sessions in order to fare the best out of this treatment process. And so that can create some issues as well. The client may feel like the clinician is trying to get more money out of them. That's come up before because they're not abiding by what the insurance company wants. So it can be a tricky area, gray area. It's something that the supervisor needs to kind of get involved with sometimes. And then you also have the ethical and legal issues with diagnosis itself. A diagnosis is important for us to be able to understand what condition a person has, but we try to avoid labeling someone as that, because that can really counter everything that we're trying to do. And what if the client doesn't agree with that diagnosis, or feels like they try to use it as a crutch, or it becomes debilitating for them because they know that they have this diagnosis. And so it can create some mental health issues, I think, in some cases. And so we try not to dwell on the actual diagnosis and let clients know, yeah, this is kind of what I'm seeing, but if we stay on this course of treatment, we should have some good outcomes. All right. Using tests in counseling, you can read about that. Evidence-based therapy practice, we discussed that a little bit. You want to use empirically supported treatments. In other words, you want to use research-backed, validated methods and modalities when treating your clients. Because if you don't, then you could open yourself up to some liability. It's, counseling isn't about just kind of going in there and trying to figure out something on the fly. You've got to have some tools in your toolbox to pull out and know when to use them, and they've got to be based in research. Unless you're doing a study on a new technique, and then at that point, that's a whole different ball game. But if you're just practicing, then you need to ground yourself in a research-based theory. Start with one that seems most appealing and move forward from there, and just continue to add more tools to your toolbox to use. So, all right, that's all we're going to cover for this chapter. I'll see you in the next learning plan.